Good afternoon. Allegheny County Executive Rich Fitzgerald here with Dr. Deborah Bogan to give our Wednesday update, every other Wednesday update now on COVID-19. It's been almost a year since vaccines have been available. It'll be in late December that they have come out. And we know how effective they have been in preventing death, preventing hospitalization, and keeping us healthier. And I'm very proud to say that almost 830,000 fellow Allegheny County residents have been vaccinated, either with, most with 2 shots, 740,000 fully vaccinated and close to another 90,000 partially vaccinated. And then there's been another 140,000 who have gotten the booster vaccine. It is time for everybody to get vaccinated. I want to thank many companies, and I'm going to read a number of them, who have instituted requirements for their employees to be vaccinated, including Allegheny County, our employees, the City of Pittsburgh, and Pittsburgh Public Schools, 3 of the biggest governmental organizations here in our region. I am asking today for every single company and every single organization to require their employees to be vaccinated by January 1st. January 1st, it will have been a year since these vaccines have been available. They are now readily available for everybody to get them. We know how safe they are. We know how effective they are. And we know how they've stopped the spread of this deadly disease. We've been dealing with this now for almost 2 years, a year and a half, since March of 2020. It has disrupted lives, it has disrupted businesses, it has taken many of our fellow citizens. I want to thank the companies, and I'm going to name some of them that have done exactly what I'm asking. They've already done a requirement. I want to thank the Allegheny Health Network and Highmark Health, BNY Mellon, Carnegie Mellon University, Chatham University, Duquesne University, Facebook, Google, Kraft Heinz, Microsoft, Mr. Small's Theater, the Pittsburgh Cultural Trust, the Pittsburgh Technology Council, Uber, University of Pittsburgh, and our largest employer, UPMC. I want to thank them for stepping up and helping us to be healthy. I am now asking all of the other companies and organizations to do the same. We're in a war. We've been in a war for, again, since March of 2020 with a virus who has taken, again, many of our lives. And I want to thank those 830,000 patriotic Allegheny County citizens who have stepped up to keep all of us safe. We want to make sure that the workplace is safe. Who wants to send their child to a school where the teacher is unvaccinated? Who wants to go to a restaurant and be waited on by a waiter or waitress that is unvaccinated? Who wants to sit in an office among people that are unvaccinated spreading this deadly disease? I could go on, but the fact is we need to make sure that by January 1st, as we turn the page into 2022, that everybody in Allegheny County gets vaccinated. So with that, let me turn it over to Dr. Bogan to give her weekly update. Dr. Bogan?
Thank you, County Executive, and welcome. We'll start with the numbers, which remain stubbornly high, certainly higher than we would hope or expect. We continue to see daily case counts in the 350 to 400 range, with some days, like today's report, surpassing 500. Unfortunately, there's no indication that the numbers will drop anytime soon. Worse news, in October, we lost 174 people to COVID in Allegheny County, making it our 3rd deadliest month of the 21 months so far in this pandemic. Only December of 2020 and January of 2021, when we were in the midst of our worst surge of the pandemic, did we have more deaths than last month. Positivity rate has also increased this week to about 8%. In short, the current data are disappointing and challenging given the approaching holiday season, colder weather, and everything and everyone moving inside, attending parties and gatherings. We all want this holiday season to be normal and to celebrate in person with our loved ones. I want that for all of us too, but I want to encourage us all to celebrate responsibly. While rates and cases in many other parts of the country have dropped, that is not the case here or in many of our surrounding counties. And frankly, that worries me. At the health department, we've been asking ourselves, why haven't our cases dropped like they have in other parts of the country? And unfortunately, we don't have any special reason other than we have let our guard down and the Delta variant is a highly contagious virus. Our case investigations and our experience in the community demonstrate that life has largely returned to pre-pandemic patterns. Mask wearing and physical distancing have decreased substantially, and perhaps people have returned to all their usual activities. You see it in the grocery stores, in gyms, in restaurants and bars, at large sporting events and concerts and other gatherings. All the things we did so well at the start of the pandemic have fallen by the wayside. It's as if people have decided that they are done with the pandemic. I totally get it. I understand COVID fatigue. Wishful thinking does not make it so. We may be done with the virus, but unfortunately the virus is not done with us or our loved ones or our community. So what can we do? Well, it's back to the basics. Most importantly, I urge everyone who is eligible, including all of those aged 5 years and older, to please go get vaccinated. If you have a weakened immune system, go get your booster. If you are over 65, please go get your booster. Remember, the vaccine is like a coach. It trains your immune system in advance on how to respond and react if it encounters the virus. Then, if you are infected with the virus, your immune system knows what to do and is better prepared to fight off the virus and avoid, in most cases, the very serious results of COVID, including hospitalization and death. Our data continue to show that most of those hospitalized and dying in our community are the unvaccinated. The deaths among those who are vaccinated are mostly seniors with underlying health conditions and those with weakened immune systems, which is why it is so important for those populations to get booster doses of vaccine now. Also, we remain in high transmission status here in Allegheny County. So I encourage us all to follow CDC guidance and wear masks when indoors with non-household members and when physical distancing is challenging. Wearing a mask is a simple and effective method to reduce the spread of the virus in our community. Masks don't just prevent the spread of COVID, they can reduce the spread of other respiratory viruses like influenza and RSV, both of which are circulating in our community right now. Personally, I can tell you that when I go to a store, I wear a mask. When I have people over to my home, I ask if they've been vaccinated, and if they have not been, I ask them to wear a mask, and I wear a mask. Here at the health department, every time I leave my office, whether it's to fill my water cup or to walk to my car at the end of the day, I wear a mask. And I ask that my staff do the same. Look, this virus has clearly polarized the world, and I'm sad about that. But it doesn't have to be that way, because when it comes to stopping a deadly virus, unity is a much more effective strategy. But no matter where you stand on any of these issues, the bottom line is that everyone has been impacted by COVID. We must act individually and collectively to protect ourselves, our friends and family, and our community. Because if we don't, this virus simply will not go away. So I thank you for doing your part. Before I end today, I would like to remind everyone that tomorrow is Veterans Day and to thank all of our veterans for their service to our country. And as a result, we will not be giving our daily report tomorrow. We will give a 48-hour report on Friday. And with that, I remind you all to please be safe and be kind. Thank you.
The first question that we have today is from WPXI. What are your concerns about the 599 COVID cases in one day today? What do you think that signals for the county?
Yeah, as I just said, I am concerned. We have holidays coming up and colder weather, and we know that people are going to be inside a lot more. And so with that, I don't see a way that our cases are going to be able to go down very soon. But again, as I've said, we really need to just get back to the basics. We know how to reduce the spread of this virus, and that is reducing the size of our parties, keeping things small, keeping your windows open to increase circulation, wearing a mask, getting vaccinated. It's that simple. It's also really important to remember that we have lots of testing available in our community, and if you've been exposed, you're concerned that you have the virus or could be spreading it, you have symptoms, go get tested. Our county sites are now open 7 days a week, and we have on our website, I'll remind everyone what that website is. It's alleghenycounty.us/coronavirus. You can find all of our test sites. It is free and available. Our vans move around and are available for people. So again, it's back to the basics if we want to reduce the cases in our community.
This next question is for the county executive from WTAE. I believe that you touched on these, but in regards to your announcement today that you're asking businesses in the county to have a vaccine mandate, why do you feel now is the time to ask for this?
Well, for a couple different reasons. Number one, we have seen over this last year how effective the vaccine has been. I mean, we've seen over the years, you read case studies of vaccines and cures that have been, quite frankly, not as effective as what Moderna, Pfizer, and J&J have been able to produce. And it has protected us. It has protected so many of us. But as Dr. Bogan said, you know, we now, in October, had the highest death rate that we've had since the beginning of the year, since back in February. So obviously the virus isn't done with us. I mean, we'd like to be done with it, no question about it. We want to get back to the normal life that we've all had, greeting people and all those type of things. The only way to get out of this is the vaccine. So January 1st, you know, we're turning the page on 2022, on the year. That gives everybody enough time to get their shot, get their second shot if they're with Pfizer or Moderna, and obviously with the one shot J&J, you can do that as well. Now that the 5 to 11-year-olds are eligible, we are seeing an uptick in the vaccine. I think today was the highest number I've seen since early June in the number of folks in Allegheny County who were vaccinated. I'm assuming that's because of a lot of 5 to 11-year-olds are doing that. So it really is time, and I think all of us want to be safe, and the only way we can be safe is if we get everybody vaccinated.
That response actually leads into the next question from the Post-Gazette. Has Allegheny County seen an uptick in the number of vaccines given, not just in the 5 to 11 age group, but across the board? And I'll ask that both of you address that.
Yes. I mean, I look at those numbers every single day, and really for the last 3-4 months, we've seen between 1,000 and 2,000 new vaccinations every day. People that are getting the first shot coming in and adding to it. Between yesterday and today, we had over 7,000. That's the highest number I've seen since early June. So it indicates to me that not only are more people, adults who have been eligible now for a number of months, but again, my estimate is that many of the 5 to 11-year-olds, and I'm seeing a lot of them around the county at various, the pediatricians are doing them, obviously UPMC and AHN are doing them, different pharmacies are doing them, so that's my sense, and I'll ask Dr. Bogan to comment on that question as well.
Actually, I think the county executive took care of it. I was going to say exactly the same thing. So spot on.
This next question from multiple outlets is actually for both of you. Earlier today, the State Health Department school mask mandate was struck down by the courts. And so being asked, so what is your reaction and or possibly plans moving forward? Should there be action at the county level?
County executive, do you want to go first or want me to handle it?
Yeah, it's unfortunate that, again, we talk about the politicization of this disease, and obviously who brought this case and got it before a Republican court to be quite frankly political about it, to overturn what the governor had done to keep us safe. My sense is the governor will now appeal the case. It almost reminds me of what we had in elections last year, and I'm hoping that the Supreme Court goes for health, follows the science, and keeps the mandate in place. The governor has indicated that he's going to lift the mandate in January when we have the ability for the 5 to 11-year-olds to have all been vaccinated and fully vaccinated. So since that only began last week, It's going to take some time, and I would hope that the mask mandate does stay in place until the governor lifts the mandate in January.
From a public health standpoint, I am disappointed. Masks are effective at reducing spread, and classes are indoors. So masks are an effective strategy to reduce the spread. And we really want children to remain in school. And the more cases we have in schools, the more days children will miss in school. It's just a numbers game. And so, yeah, I'm disappointed.
This next question is from the Post-Gazette. Do you think the approval of a children's vaccine has shifted the mindset of some adults who are more hesitant about getting vaccinated themselves?
A great question. I don't really know. I sure hope so. The data on vaccine safety continues to mount, right? There have been 7 billion, that's billion with a B, doses of vaccine given around the world. What more data do people want? I mean, that really should speak for itself. So.
And this final question for the county executive is from actually a resident, Judith Torre. You just addressed what you are asking businesses to do regarding vaccinations, but can people be required to wear masks at dense gatherings of people, even in outdoor settings? And what are your plans to be more visible on COVID mitigation?
Well, I hope to think that Dr. Bogan and I have both been very visible throughout this pandemic on the strategies that we've needed pre-vaccine with masking and distancing, et cetera. As Dr. Bogan has indicated, we should still continue to follow the CDC guidelines when it comes to masking in indoors and in crowded places where you can't distance, and that becomes difficult. But we also know the only way out of this is the vaccine. President Biden said many months ago, the pandemic is now a pandemic among the unvaccinated, and that's in large part true. So we need to get as many people vaccinated as we can, so that people have confidence that when they they go to a bank and they meet the bank teller, when they go into a meeting with people, when they invite someone to come into their home to do service or repair, et cetera, that everybody that we come in contact with, we want them to be vaccinated, and that's really what we want to do. As Dr. Bogan indicated, we're coming into the time of the year in which outdoor events are going to be more limited. The weather's going to force us all indoors. So the gatherings that we have coming upon Thanksgiving and Christmas, we know what they did last year. We know how those cases really spiked in January and February, and our fatality rates, our hospitalization rates, et cetera. So we know what we need to do. Our medical experts, from the CDC to the NIH to Dr. Bogan to Pennsylvania Department of Health, have given us the strategy and the way to move forward. So let's hope everybody works together, comes together, keeps our community safe, keeps their families safe, keeps themselves safe, and we move forward. So let me also echo Dr. Bogan's remarks and wish everybody tomorrow happy Veterans Day. Our veterans have done so much to provide the freedom for us, and in many ways, a lot of them have been at the front line to get vaccinated and do the things that we need to do during this latest war that we have with a virus. So with that, we'll be back to you in a couple weeks. Thank you.
Thank you for joining us. Our next regularly scheduled briefing is November 24th at 4 p.m.